First at 4, we are tracking that major breaking news on the COVID-19 vaccination effort. The CDC and the FDA urging a pause in the use of the Johnson & Johnson single-dose shots after reports of rare blood clots. Good afternoon. I'm Kim Kalunian.
And I'm Brian Yacono. Both Rhode Island and Massachusetts have already stopped using the shot, and it is causing some disruptions. First, let's take a look at the data for you. More than 6.8 million Americans have received this vaccine. Federal health officials say 6 recipients had blood clots. One of them died. All of the patients were women between 18 and 48. They developed those symptoms a few days after being vaccinated. As health officials investigate, Johnson & Johnson says there is no clear relationship between these rare events and their vaccine. This afternoon, we're starting to learn how this move is impacting Rhode Island's vaccine rollout. 12 News reporter Brandon Truitt joining us live now from East Providence with the very latest. Brandon.
Well, Kim, public health officials nationally and here in Rhode Island really spent much of the day providing context to this. They say that what is happening is a sign that the systems are working, catching these types of things, and that vaccines are overwhelmingly safe. The race to vaccinate hitting a speed bump Tuesday morning. The FDA and CDC recommending a pause for Johnson & Johnson COVID vaccines, expected to last a matter of days.
We're recommending this pause while we work together to fully understand these events.
The head of the FDA saying there have been just 6 cases of blood clots in the 6.8 million J&J doses administered nationwide. 6 women between 18 and 48 years old. The CDC review aiming to find commonality between them.
We have not had any of these adverse events reported.
Dr. Nicole Alexander-Scott saying the statistical chance of these side effects is roughly 1 in a million. And with just over 35,000 J&J shots administered in Rhode Island, it hasn't happened here. The state says if you've received a Johnson & Johnson shot in the past month, check for these symptoms: severe headache, abdominal pain, leg pain, or shortness of breath. If any of these linger, contact your doctor.
The symptoms occurred 6 days to 13 days out after vaccination.
The doctor distinguishing a difference here, saying the side effects being studied are not the same as the symptoms you feel in the hours following a shot. So Rhode Island's J&J doses were going largely to pharmacies just like this one here. They say what is happening with Johnson & Johnson isn't going to have too much of an effect on distribution, and that's because J&J was only accounting for roughly 5% of all of the doses the state has administered so far. So Brian and Kim, the state is expecting to still expand eligibility to all adults in Rhode Island on Monday.
And Brandon, any word on what's going to happen with the J&J doses that are now just sitting around? Is the state concerned at all about wasting those vaccines?
Yeah, the state had to answer this earlier today. They're saying that most of these doses, well, are getting used very quickly. They're thinking around 10% might be stored somewhere. Of that 10%, remember, Johnson & Johnson far more easily stored than Pfizer and Moderna. That's a plus here. Ultimately, how much is going to waste will depend on how long this pause lasts, guys.
A lot of questions coming here. Brandon Truitt live for us in East Providence today. Thanks so much.